Very much, Mr. Chairman. Good morning to all, and thank you for coming to testify today. The dangerously high price of prescription drugs is a serious social problem that we've long sought to address. In the last two Congresses, Democrats on this committee held 5 hearings on how to make medication more affordable and accessible to Americans. The average American spends more on prescription drugs each year than people living anywhere else in the world. In 2022, more than a quarter of U.S. grown-ups reported that they did not take their prescription medication at some point in the last year because they couldn't afford it. So we're in an affordability crisis. No American should be forced to choose between living expenses like groceries, rent, or transportation and affording their life-saving medication. In the wealthiest country on earth, every person should be able to access the care and medication they need. The committee's focus on the problem of the PBMs is an important bipartisan step forward in addressing the overall crisis of healthcare in the country. But this crisis begins with the outrageous pricing of pharmaceutical drugs by the big pharma companies. Under former Chairman Elijah Cummings and former Chair Carolyn Maloney, this committee spent 3 years investigating the ways some pharmaceutical companies use unjustified and unfair pricing practices to enrich themselves at the expense of patients across the country. Former Chairman Cummings observed how, quote, for years drug companies have been aggressively increasing prices on existing drugs and setting higher launch prices for new drugs while recording windfall profits. The Oversight Committee's investigation found drug companies engage in anti-competitive practices to keep drug prices high and exploited the fact that Medicare was not allowed to directly negotiate drug prices with them. Acting in response to these abuses, Democrats moved and passed historic legislation, the Inflation Reduction Act, to reduce drug prices. Thanks to the IRA, Medicare will be permitted to negotiate prices of dozens of the costliest drugs directly with big pharma manufacturers. This will help prevent drug companies from taking advantage of the ways that the Medicare program differs from similar programs in other countries to enrich themselves at the expense of older Americans and American taxpayers. The IRA will also cap the price of insulin at $35 a month for people covered by Medicare. Seniors who take insulin for diabetes will no longer be forced to ration their life-saving medication as drug companies rake in record profits. And the IRA caps out-of-pocket costs under Medicare Part D to $2,000 a year, indexed to inflation, bringing much-needed relief to seniors, like in my district, who are spending thousands of dollars, $5,000, $10,000, $15,000, just to cover the cost of their medication on a fixed monthly income. But the fight for affordable medication will not stop with the Inflation Reduction Act or the Medicare program. President Biden has put forth bold proposals to expand these cost savings to all Americans, including by capping the price of insulin at $35 per month for all diabetics in America, not just those in the Medicare program. We're also investigating the role of the pharmacy benefit managers, PBMs, in the prescription drug affordability crisis. As intermediaries between insurers, drug companies, and pharmacies, PBMs wield tremendous influence over how much a patient pays at the pharmacy counter for a medication prescribed by their doctor and whether a patient can even afford to obtain their medication at all. If the U.S. healthcare system worked as intended, PBMs should be negotiating lower drug prices on behalf of insurance companies who would then pass the savings on to their patients. But that's not what's happening. As we'll hear today, some PBM practices appear to be increasing the cost of medicine, actively preventing patients from accessing the drugs that their doctors have determined are appropriate for them, playing outrageous hide-and-go-seek games with people's medicine and hurting independent and community pharmacies. The House Oversight Committee has been working to expose PBMs and how they are undermining patient care. That's why former Chair Maloney launched an investigation last year into whether the practices of the PBMs and health insurers in the country create financial barriers for patients trying to access birth control. Under the Affordable Care Act and related guidance, contraceptive products that a patient's healthcare provider deems medically appropriate should be made available to that patient at no cost. The committee's analysis found that certain products, including newer ones, were less likely to be made available by PBMs and insurers at no cost to patients. Patients or providers have to know to ask insurers and PBMs for an exception to receive these products for free, and the committee found that PBMs and insurers denied an average of 40% of those requests each year, which is outrageous. Today's hearing is an opportunity to build on this important work. I look forward to hearing from each of our witnesses about the ways that PBM practices may deny or delay patients' receipt of their affordable medications. But PBMs are just one piece of the puzzle. Drug companies are ultimately responsible for setting high prices, and in fact have poured millions of dollars into TV and social media ads, as well as lobbying, to deflect attention away from their own role in setting high drug prices by shining the spotlight on the PBMs. So I would ask all of our colleagues to join with the Democrats in taking decisive action to lower prescription drug prices and engage in comprehensive oversight of the entire healthcare system, not just this part of it. I hope today's hearing is just one of many dedicated to building upon this committee's longstanding work to improve access to affordable medicine for all. Thank you, Mr. Chairman. I yield back.